Welcome to Empowered Ease. I'm Jen Olinger. This show exists to challenge the patriarchy by celebrating women who help others in their way and in their time. Women who choose slowing down, self-love, and honest inner work over hustle culture. Beginning now, Empowered Ease will release new episodes twice a month on Mondays. Each episode brings you a powerful woman, a leader, a healer, a parent, or a caregiver, who invites us to pause, go within, and ask, who am I? What do I really want and need? We slow down together, we learn practical tools, and we reclaim our permission to rest, to receive, and to shine. So thank you so much for joining me. Please like, follow, and review the show so that you never miss an episode, and also because it helps us to continue to grow. So welcome to Empowered Ease. Hello, everyone, and welcome back to Empowered Ease. I'm Jen Olinger, a holistic coach and critical care nurse. Twice a week, I sit down with amazing women who are making a difference in the lives of others. This week, I bring you Dr. Bridget Lybarger. Bridget is a chiropractor, an acupuncturist, and a functional medicine practitioner. Bridget owns Stages Wellness Holistic Center and Absolute Chiropractic and Acupuncture located in Belleville, Illinois. She focuses on a natural holistic approach combining chiropractic care, acupuncture, and functional medicine to help people find balance in mind, body, and spirit, which helps people to live their fullest, happiest lives. I am so happy to introduce and bring you Dr. Bridget Lybarger. Welcome, Dr. Lybarger. How are you today? I'm so excited that you're here.
I'm doing really good. Thank you so much for having me, Jen.
Yes, so I've been dying to have someone to come on to talk about actually all three things that you're into: chiropractic, functional medicine, and acupuncture. So tell me a little bit about your practice and how you got into your practice to start.
All right. Well, I own Stages Wellness Holistic Center in downtown Belleville, Illinois, and I have been a chiropractor for 22 years. I've been an acupuncturist for 15 years, and I've been offering functional medicine now for about 6 months. And I just rented out space for the first 15 years of my life and was just a chiropractic and acupuncture practice. But I took the lead 3 years ago, bought a building in downtown Belleville that was built in 1868, and I started a wellness center. Because really what my practice focuses on is mind, body, and spirit balance.
I love that. I love that. So how do you incorporate the mind, body, spirit aspect into your physical practices?
I teach patients a lot of what they can do outside of here, first and foremost, because I believe that we all have the power within us to heal ourselves. Quiet time. In this busy, busy world, I try to teach people to just be quiet, meditate, go out in nature, because healing yourself does not cost a lot of money. I mean, we've got the sunshine, we've got nature, you can go for a walk, walk your dog, but being alone, I think, is very important too. And I think a lot of women, I think the expectations and the belief systems and all of that has just taken over this world. And we just get burnt out
Yeah.
big time.
Yes.
Especially if you're, working full time, you've got a family, a marriage, friends. I just tell people it's all about self-care. And that's where I try to teach people is a lot of what they can do outside of my practice. And then holistic healthcare too. Holistic healthcare is a necessity, getting adjusted. That's all about the nervous system. Acupuncture, that's all about your energy system and working that energy through your meridians, because everything is energy and energy wants to move. So that's what's so cool about the acupuncture side of things is it really taps into that emotional body, which once again in this world, I think sometimes we're not taught how to deal with emotions.
Oh
So
my
that's
God,
a
yeah.
big part of what I do is try to help, especially women, deal with traumas, emotions. And then the functional medicine side of things, that's just getting to the root cause of issues issues through blood work testing, urinalysis, hair tissue samples. So it's kind of just a whole combined wellness center that offers all three things along with energy work. I'm a big believer in energy work too.
I love so many things that you said there. And I think you hit like three. I've been a critical care nurse for like the past 12 years. So I'm board certified as a holistic nurse. And there's like, I've always thought of like the nursing model is a holistic model. It's patient forward, but that part is so skipped in medicine. The education piece you said is so skipped. The mental health piece is skipped. Like all of that, and it's less and less these days, like preventative care, education, it's like it's all getting squeezed out. And to me, these are like the fundamental things of how you avoid so much down the road. So I love that you touched on so much of that.
Hmm.
What brought you to this practice? What do you think drew you to this kind of work?
I have always wanted to be a healthcare provider ever since my very first memories. I actually wanted to be a pediatrician. And then just going through high school, taking all the anatomy courses, biology, all that kind of stuff, I really was drawn to physical therapy. So then I went into college, and all of a sudden there's something I just did not want to be in the medical model. So kind of a divine intervention happened. I was going to school well, it used to be called Belleville Area College. It's now SWIC, Southwestern Illinois College. And I was drawn to the library. I pulled out the giant blue book of colleges. And I didn't want to go far away. So I was looking in St. Louis, Carbondale, and I saw Logan College of Chiropractic. And at that time, I was about 19 years old. I was in my first apartment on the west end of Belleville, and a chiropractor practiced across the street. So I was like, I wonder what this chiropractic stuff is about. Because my mom was a nurse. We always did things. If you had an ache or a pain, you took ibuprofen. It was just a whole different lifestyle than what I live now. But anyway, so I got in my car and I drove to Dr. Joe's office. He took me in as a patient, and I had chronic headaches my entire life. And it turns out they were coming from misalignments in my neck. 90% of headaches come from your neck. So he started adjusting me, educating me, and I decided I wanted to be a chiropractor, and he wrote me my letter to get into school. So that's what
Oh,
happened.
I love that. I love that so much. When I went into healthcare, I went in thinking that like the critical care was going to be like acute, like these acute outlier things. And now that I've been working in it over a decade, I'm like, most of it's chronic illnesses, the result of like either just like not knowing or negligence of your health in some way, which there's no blame associated with that. But
Sure.
and the very small amounts of it are emergencies. Even when I worked in trauma, there was so much of like the chronic illness aspect. And so
Mhm.
these other modalities for health and wellness are so important to me. Functional medicine, I think, is amazing and so like underused
Mhm.
because there is only so much you can get in our modern healthcare system when you want to look into what's going on, and especially preventatively. I have this going on in my family right now with one of my brothers who's had GI issues forever and doesn't have insurance, and the healthcare system will not really take a close look at him. And so that's what I love about functional medicine is it's like willing to dive a little bit deeper and give you like a really like close up look at well, actually you tell me more about why it's so great. I'm like, you're the one to explain what it is, but tell me how functional medicine can aid people. And because I don't think people really know what it is.
Yeah, yeah. Functional medicine really is just a deep dive look at the root cause of an issue, like say a gut issue.
Mm-hmm.
So I can send you for blood work testing, thyroid panels, hormone panels, cardiac panels, cancer panels, all kinds of things. Cortisol, which doctors, MDs, a lot of time don't look at just stress being an issue. But then also I can send you for urinalysis, stool samples to just take a deeper dive into the gut and the urinary system, and then hair tissue analysis. Hair tissue analysis really looks at like toxicity that you hold within your hair. It tests for like 25 different toxic substances and then about 25 different minerals too, because we hold a lot in our hair. And honestly, we live in a world that is constantly radiating us, poisoning us with the tap
Mhm.
water and the food. And, you know, a lot of times MDs don't look at even just food. MDs actually only have 4 hours of training in nutrition. And your food is your medicine.
As
For
like the
functional
building
medicine,
blocks of your body.
it is, you know, and I find a lot of time people, number one, are chronically dehydrated
Oh,
and people are
yes.
still drinking tap water. And then you talk about just the food. I mean, people aren't eating enough protein, good fats. People still think cholesterol is a bad thing. So it's just a whole holistic way of looking at things. And then, two, I feel like it gives people hope. Because I think sometimes the medical world sometimes can take that from people because they don't listen to people. So I find that a lot of functional medicine docs are chiropractors. And I think a really big thing that we do is listen to people first and foremost. We have empathy for how they feel because a lot of us have been through, you know, those same issues too. So also too, you know, the use of vitamins, you know, a lot of people are on vitamins. Vitamins are not FDA regulated. So a lot of times people are getting on Amazon and they're just, you know, listening to these spiels. I mean, you and I could make a vitamin and sell it. They're not FDA regulated. So I find a lot of times people are taking things that are not good for them and
Mhm.
really don't need that much. You know, and thirdly, too, with functional medicine, it's affordable too. You know, when you look at the medical model, I mean, it can be so expensive. I mean,
Oh,
you
yeah.
send people for just say a cortisol hormone check, which is your stressor hormone. It's $30 to be sent for that. So, you know, in terms of affordability, I think everyone at every income level has access to get the functional medicine. Sometimes I just don't think people know that or think that they can't afford it.
And I was under the understanding that a lot of the panels that you run are not even offered. I don't know if that's true or not, but like
Well, I
that
find
you
what
go ahead.
I just find that when, like, say a woman goes to their MD and says she's having hot flashes,
Mhm.
a lot of times they just get brushed off. Oh, you're in perimenopause. And they might send them for like an estrogen check. But there's a full hormone panel that needs to be looked at when you're going through perimenopause. It's like a list of
Exactly.
7 or 8 hormones. So therefore, I think a lot of the MDs and even the gynecologists just aren't knowledgeable enough on how deep you can go into the dive of looking at hormones. And also,
Yeah.
too, there's so much natural stuff that you can do to help hormones. Because a lot of times I find they're just throwing women on hormones without even checking what their levels are.
Yeah.
That's just blindly treating someone.
I have an OB/NP coming on next week. Or well, she'll be on in a couple weeks after this, but she's my next interview. And that was her thing. Is like everyone keeps coming to me. We send them for this basic panel, and it shows nothing, but they're clearly having. So she went and got the advanced. I don't know what through, but all the advanced education that is newly available because we didn't bother to study it forever. But and so now that's what she's offering and specializing in because it's so common and it's so sad that like I've experienced it myself going to the doctor and being like something's off and just not there's just I'm not offered anything else, you
Mhm.
know,
You
which is
know
sad.
that, and sometimes you're just offered a pill, you
Oh well,
know.
I was offered an antidepressant, but
Um,
to
you know,
take
and I do think
when
that
I
there's
was
a
on PMSing.
yeah, I think that there's a time and a place, you know, and I
Yeah.
think every individual is different. I do look at every single patient that comes in here different. You know, we consult, I listen, let them talk, and then we decide what avenue of care to start with. You know, but two, I just think that there's so many natural, I mean, God, spirit, the universe put so many natural things on this planet for us to use. And mainly sunshine, you know, vitamin D is so important to get from the sun. Supplementing in the wintertime is a good idea. Good water, rest, meditation, nature, all of that is free, you
Yeah.
know? So
Well, and
I try to
assessing your
keep,
life, like a lot of people don't look at their own life, the patterns they're in, or just the responsibilities they've gotten, try to figure out how to work within that because we're always trying to change things instead of like
yeah.
work with what we have too.
Yeah, and I think, you know, a big thing too is just silence, you know? I just feel like taking a break, putting the phone down, stop the doom scrolling, stop trying to distract, yourself from, what you already had, the magic that's within you. So, turning on your own power and seeing that we're all magical beings that have the power to heal ourselves. I mean, these bodies that we were given are so magical. I think that people have just forgotten that.
Yeah, and we don't know how to listen to them anymore because we've created there's such a separation now between even like it took me like I've said this on here a few times, but it's just so funny to me because I think so many people are in this place. Like the first time someone asked me where I felt an emotion in my body, I thought they had like three heads. I was like, what are you talking about? And now I'm like totally get it. I focus on that all the time. Where am I feeling this? Like breathe into it. That's where the power's at. But that even realizing that concept was like I was like, what? That doesn't happen. Like
Yeah, because you think of it as something that's like outside of you. And that back to acupuncture, that's what's really cool about acupuncture is through your different energy meridians that go through your body, each organ is associated with an emotion. So when we talk about spleen, that's about worry or trust. When people are worried all the time, everything's tight, stiff, achy, and your spleen controls all of the muscles in your body. And your gut, they're muscles too. They're just smooth muscles. So when you're worrying constantly, a lot of times people get constipated.
Mhm.
Our liver is our kindness or our anger organ. I always have to nurture the liver because it's the detox metabolism organ too. But that's where we hold that anger and that go and do. And a lot of times, like you just said, when you tap into like say you're angry about something, if you really just quiet yourself, breathe a little bit, you can feel it in that actual organ. So
That is so
that's what's
cool.
really cool about, Chinese medicine too. It's been around for thousands of years and it really helps to release those emotions. I actually have a lot of people when they're getting acupuncture, they cry, which is wonderful because tears are the window to the soul. It releases
Yeah.
serotonin when you cry. And a lot of times they've said to me, I have not cried in years. So it's beautiful to see. It
Yes.
really is.
I'm gonna have to come try. I've never tried acupuncture, but I've been so it's just fallen through. So I'm gonna have to book an appointment and come try it because I've been dying too. So
Absolutely. Yeah. And who
one of
doesn't
my
need a good
roommates
cry
used
every
to get
once in
it
a while?
religiously, and she would just tell me how amazing it was. She just said it was so like stress relieving for her.
Oh, and that's exactly what it is. Because I mean, number one, you get, 25 minutes to lay on a wonderful biomat with the needles in you to just chill with some nice music going and do some deep breathing. So it's kind of like a meditation, healing, just a centering kind of a practice too. And two, Qigong. I don't know
Oh,
if you've ever heard of Qigong before.
I have.
Qigong is what people can do outside of here to help their bodies keep that energy flowing through those meridians because it's all about stagnation. Once again, energy just wants to be in motion. Tapping, is a big part of Qigong. And there's tons of free YouTube videos on Qigong. Lee Holden is one of my favorite. Yochi yoga is another good one, but also too, yoga. Yoga's movement, it's medicine, and
Mhm.
that's all free. You don't even need a yoga mat. You just put a blanket on the ground or, in your house or go lay by a tree. Hug a tree.
Yeah. Yeah. Yeah, it's funny. People who are from India like laugh about how we treat yoga here because it's really not that big of a deal there. It's not well, it's a big deal, but it's not like treated like it is here. It's so funny. I love that. Okay, so you brought up some fun thing. I've been like, love that. So can you explain maybe for people that don't understand acupuncture a little more too? Who might be curious about it, like what that entails and how it works?
Yeah. So with acupuncture, you have energy meridians that flow through your body and they're all connected by your organs. And there's something called chi energy, which it's spelled QI. They talk a lot about it in yoga and qigong. That chi energy flows through those meridians. And what happens from chemical, physical, emotional stress is that energy gets clogged or stagnant or it starts moving too quickly. Most of the time, and especially in a country like this, where it's just the busy life, things get stagnant. So when that energy gets stagnant, pain can happen, fertility issues can happen, stress, anxiety, insomnia. So what the acupuncture needles do is they're just tiny little needles. Now there's all different kinds of sizes of needles. I mean, they use some big ones over in China. The needles that I use are tiny. I mean, they do. I saw when I was in acupuncture, I was like, no thanks. I
I
mean,
didn't
we
know
use
that, but I
acupuncture
find that
for
so
like
interesting.
dental care to numb up the mouth. I'm like, nah, just go to the dentist. But anyway, so these needles, they're tiny. They're about as thick as a piece of hair, and they get inserted into these different points on your body. Right here is large intestine 4. That's a very common in between your thumb and your pointer finger. That is the most commonly used acupuncture point. Most of the time, I'm inserting a needle into that point right there. So you insert that needle in. Sometimes I dial that needle in a little bit to get into that chi energy because your chi energy does flow through your blood. And then what happens is that invokes a nervous system response to get that energy moving through that pathway. So, and there's needles, most of the time, your hands, your elbows, your chest, lung, large intestine, and heart run through your arms and your chest, stomach, spleen, low back,
Is
and
there a
quad.
forehead one? I feel like I've heard about the forehead one.
There's actually one on the top of the head. It's a meeting of 1,000 points. That just resets your whole energy. But yeah, there's
Okay.
all kinds of like sinus points,
Oh, yeah.
third eye, sinus points here, TMJ, jaw points.
Oh,
You can
yeah.
do thyroid points, lung points to open up that whole chest, get that breath moving. Because once again, back to breath, that is how we move the most energy in our body. So if anything, if anybody takes anything out of this, start breathing because a lot of us just don't breathe properly. But when those needles are inserted, you just lay there for about 20 or 25 minutes while those needles are doing their job of getting that energy moving. And then I just come in and take them out, and that's the session. And then also too, you can lay on your face down too, and there's a whole bladder channel through your spine area, and that just really helps head, neck, mid back, low back, glutes, legs, sciatica points, things like that. So most of the time, people are laying on their back though, because there's a lot of powerful points on the front of the body.
So, what does that help for people who struggle with like chronic pain issues and autoimmune issues? I would assume are people that could really benefit from that.
Absolutely, yeah. Because when it comes to, autoimmune, your body attacking itself, or chronic, it's like fibromyalgia, really that's just a whole bunch of stagnation, which leads to inflammation in the body. So
Because
it
usually people are
absolutely helps
stuffing
with that.
emotions, right? Repression, isn't that autoimmune diseases repressing things?
Absolutely. And that's, chiropractic is really cool too, because of course the nervous system is the computer of your body. So getting adjusted is very important too. But I do find that sometimes acupuncture does tap into that deep down emotional body that sometimes an adjustment might not be able to get to. But it's also about what that particular patient is, willing to sometimes, release too. But I think
Yeah.
it really makes them aware of what they may be holding within
Oh,
their
yeah.
that's causing pain.
That's what I found with energy work is sometimes I can tell something's off, but it takes me different modalities of energy work to really come to figure out what it is. Because I
Mhm.
like know, but I can't figure out what exactly it is. And sometimes it's this kind of work that helps me figure out like, oh, it's this that I'm really struggling with, like this memory or this incident, and it relates to everything. But how does posture relate to health with your chiropractic work?
Well, when grandma used to say stand up straight, she was definitely right. We live in such a digital world where everyone is just looking down at their phones or a computer or an iPad, that when you hunch forward like that, number one, you're not getting that full oxygen up into your brain. And then two, it just, hunching forward like that really affects your low back and your hips too. So stretching, stretching is
While
everything.
you're talking,
Yeah, just moving, rolling the head, tapping into those areas to get energy moving. So posture is definitely key. We live in, such a world where people are sitting, 8 hours a day. The body is not made to sit like that. It throws off your hip flexors, it throws off your pelvis, and then it just creates such tension in the neck, causing
yeah.
aches, insomnia, insomnia. And then what that does is that causes subluxations, which are bones out of place in the spine, which that happens from chemical, physical, emotional stress. So posture really is key.
Yeah, I had a client who had she survived a cancer diagnosis, but then developed some sleep apnea. But it was actually her straightening out her. She had this protective posture, and when she was able to fix her posture, her sleep apnea went away. Which I was like, "Oh my god!" I mean, like I would never have related the two, but now that I think about it, it makes total sense with everything, and
Oh,
like just even the
absolutely.
anatomy. But I just never thought about it, and I was like, "Man, that is so interesting." So it makes me think and so much more is related to posture than we really realize. And I love watching, I love that your starters in physical therapy too, because there's some really great physical therapies that put therapists that put content about like how ADHD affects your posture and a lot of common things that follow that are all related to the way you carry your body. And I just find that stuff so fascinating because we're so unaware of it. But it's like, wow, these are like simple things that just awareness can help you with.
Oh yeah, and that's one of the first things I check with every patient that comes in is their posture. And most people don't, they don't even realize that they don't have good posture. I always recommend it's a styrofoam roller. They're on Amazon for about $20. And it's I always recommend the 3 foot long styrofoam roller that you can roll your back out on. You
Oh,
can roll your
yeah.
mid back out on, you can roll your glutes out, stretch your hamstrings, and $20 to have with your little self-care area, you just can't beat it. And then
Yeah.
rolling out that mid back from living in such a digital world where we're all looking down all the time, it just feels so good to open that chest up. I honestly don't know how people live without them. Because
Hmm.
also too, posture, when it comes to posture, from the front and the back, we should be perfectly straight, even shoulders, even hips. That's a rarity too. In
Oh,
this world,
yeah.
from the side, you should have like a forward shaped curve in your neck and a back curve in your mid back and a forward shaped curve in your L back, kind of like an S. Most people are straight in that neck area, which puts a lot of tension onto your shoulders and the back of your neck. And then it's hard for oxygen to get up into your brain when you're all tied up in those areas.
Yeah.
So there's a
I think mine
cervical.
actually curves the wrong way I think it's from backpacking, but I know phones and stuff like that can do it too. But I backpacked when I was a lot younger and you like curved to pull the weight. So I think that's where mine's from, but I've been a nurse too. So it's a lot of the same.
Yeah, yeah. And there's a cervical, it's like a styrofoam thing that I recommend for people on Amazon. It's right around $20 too, and you just lay on it for
Oh,
about
I
20
have it.
minutes.
I know what you're
Oh,
talking about.
perfect. Yeah, and
Yeah.
that's a really good time to just take 15 to 20 minutes to yourself and just do a little bit of meditation, listen to some solfeggio tunes or some sound healing and
Lay
just
under
chill
your
out.
red light.
Absolutely. I love red light
Me
therapy. I'm
too.
really good about doing that during the winter time. It's awesome
Yeah.
for your body.
It helps a lot with the seasonal because we live in the Midwest and it is gray here for like 3 months straight. And it really takes a toll on me. I'm like, oh my God, this is insane.
It definitely does. I agree.
So, in your practice, when people come in, do you offer these modalities individually? Do you assess people and make a plan? How does it go when people come to see you?
Everyone who starts here has a consultation. And
Okay.
in that consultation, we talk about, exactly what they have going on, whether it be pain, stress, they want to get blood work, whatever it is. And then we decide which route to go, whether it be starting with acupuncture, chiropractic, or functional medicine. And a lot of times when people do the chiropractic or the acupuncture route, they end up getting one or the other as well, because I do offer a combo service for a little bit of a discounted rate when you get both of those services on one day. But typically we start with just one modality just to see what works for people. I don't want to overwhelm anyone. Most of the time, I'll suggest just starting with a little bit of supplementation and go from there. And then just a lot of teaching them what they can do outside of here. Because too, that's accountability. People have to be accountable for their own health. I can only
Yeah.
do so much here. You've got the power to do so much outside of here. And then also too, it makes them realize, it's self-confidence, self-worth, and then two, it's just cheaper in the long run, really. I'm not a clinic where you're going to come get adjusted once or twice a week for 3 to 6 months. It's just not going to work that way. I really want you to be able to do things outside of here. Maintenance care is very important too. I always educate people about maintenance care, such as getting adjusted once a month is a good idea. That's what I do. I get a massage every month. I get Reiki energy work probably about every 1 to 2 months, and then acupuncture once a month. So maintenance care is a good idea because that chemical, physical, and emotional stress that's always going to be there is just going to cause, sometimes bones to misalign or energy channels to clog up. So it's just a good idea to do. You think about going to the dentist, getting your oil changed. It's important to take care of your teeth, your car, and your whole body.
I love that you say chemical with the stress because I don't think we associate that, but stress is chemicals. So I love that you say that because that makes it feel a lot more like it does affect your body. I like how you
Oh
say that.
yeah, and too, sleep is chemical too, because it's
Oh,
all about your, what I mean, your hormones. And, a lot of times people just don't sleep. They're staring, looking at your phone at night before you go to bed is like looking at the sun at 12 p.m. People
yeah.
stay up too late, they eat too late. Really, I find just trying to help people get into a good circadian rhythm helps so much, the most, more than
Oh my
anything.
gosh. Yes. I was sleep deprived, I think, for like a decade and didn't even realize it until I like my husband was it was so good about sleep because he worked this job that went night day and he
Hmm.
taught me how to really respect my sleep and I feel like so much of my health changed the
Yeah.
moment I started really sleeping. And it was just like this thing that I'm like, "Oh my God, how many people don't even know how because we hear it so much, but how many people let it sink in? How are you really sleeping? Are you waking up at 3 a.m.? Are you
Yep.
tossing and turning? How much do you get up to pee? Are you really sleeping?" And a lot of people aren't.
When you sleep, you heal. And plus too, you don't have to think about anything. It's wonderful. But that's when your mitochondria, the powerhouse of the cell, that's when they're recharging. Things are, it's you heal when you sleep. It's extremely important to get into a good sleep routine.
I love that. I love that. So powerful. So where do you suggest if people are listening to you this and they're like, oh my gosh, I need like all of that, but not everyone's like local in the area. So people that are just listening, where do you suggest they get started or how they like, get more of this kind of like education in their life?
Well, if people live around here, obviously coming to my wellness center, but if
Yes.
people don't live around here, I would really suggest finding a chiropractor or an acupuncturist. A lot of times chiropractors do acupuncture, just starting that route. And then, too, a lot of times that doctor probably does functional medicine or knows someone that does. Um, but too, if someone doesn't want to go the route of, trying either of those modalities, meditating,
Yes.
just quiet. God's one and only voice is in silence. Spend some time alone. I think a lot of illness comes from, and a lot of depression and anxiety comes from people just not being able to be alone. you know
Yeah.
I
Sit
think
with
people are
themselves.
scared of it. I mean, I love to be alone, but it took me some time to give that gift to myself too, because I think people too, the guilt and the shame and the, I've got this to do and I've got that to do. You deserve it. Just give yourself some alone time every single day, and it's free.
I love that. That's great. Yeah. I think it's hard for some of us to like, there's a low level anxiety people have to address sometimes. You have to learn to sit with, and it's hard. It's really hard.
It is hard, and I also, hope, always, you're going to have good days, you're going to have bad days. Every
Yeah.
day is a new day. And I think a gratitude
Oh,
practice
yes.
is really nice too, because we really are just very lucky. I think
Mhm.
sometimes people just get caught up in that monkey mind, you
I
know.
love that. Yeah, gratitude. That's such a great suggestion because gratitude seems is something that's so overlooked with how powerful it can be. I have like one of my really close friends lost a son, and and the only relevance I say that is because when I talk to her about like getting through it, gratitude is the thing she comes back to all the time. She's like, it sounds so silly, but being grateful for what is going well, what you have, the people in your life is like, it's the hope that people need. And so a lot of us have a lot of things that we could be grateful for, and we just need to slow down and take the time to acknowledge it. And so when I'm like really struggling, I try to remember that I have this gratitude journal that one of my guests sent me actually, and I like pull it out and I'm like, okay, gratitude time. Because it's true, there's a lot to be grateful for, regardless of what's going on in your life. So,
Absolutely. Yeah. And, just back to, listening to videos too, just retraining your mind. Wayne Dyer, Maya Angelou, Joe Dispenza. There's so many free things that you can listen to on different platforms and just have your headphones in and, just having that in the background because it takes retraining your mind to actually relax too. Because we're not taught, at least I wasn't taught that when I was growing up. I mean, I
no, me
wish
either.
that they taught that in school. It was go, 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 do, be better, be this, be that. That's not what we're here for.
Yeah, and I think that narrative is pushed in social media too. I know there's a lot of wellness out there too, but wellness also can be this like perfectionism. Sometimes it can get twisted and it's this like do everything, be everything to everyone, wear all these hats. And I really think health is kind of the opposite of that.
Yeah, you really have to fill up your own cup before you fill up anybody else's too, Hard lessons learned for me, people pleasing, taking care of everyone else, before myself. That's definitely not where it's at.
Yeah, yeah, you just burn yourself out even faster. I
Yeah,
love
you
that.
can't give from an empty cup too. So
I did want to ask you one question that I forgot earlier. So, if someone has a fear of like needles, or I know like for in the nursing community, neck adjustments is something we're afraid of. And the common things that come up when they hear about these modalities, how do you address those with people, or what would you say to those people?
So, in terms of people being afraid of needles, I will literally pull out each needle that I use is a one time use. I will pull out a needle and I will put it into a couple different needles into my own body to show them how it's really not that big of a deal. That tends to alleviate a lot of their fear. I also tell them too and show them an acupuncture needle is nothing like a hypodermic needle. The size is 0.08 millimeters in terms of the needles that I use. It doesn't go into your veins like a hypodermic needle would. So I literally will show them to dispel some of that fear. And then too, a lot of people have tattoos, and I'll
Yeah.
ask, do you have a tattoo? And most people do. And I'm like, well, this is nothing like getting a tattoo. If it's a woman and they've had a child, I will definitely say you have given birth. So and everybody's had something that's caused a lot of pain in their body.
Hmm.
It's just nothing that even compares to that pain level. So I think too, just talking to them, and answering any and all questions and being very informative. Because I'm a very analytical person. I want to know, well, how does this work? What are we doing? How long am I going to be here? And I think teaching people and talking to them dispels a lot of that fear too. And then in
Yeah.
terms of neck adjusting, you have to do orthopedic tests on people. Number one, to see if it's safe to manually adjust their neck, because there are some people that should not have their necks manually adjusted. A lot of elderly people, I wouldn't even think of adjusting their necks manually. And I think a lot of things that people don't know is there's thousands of ways to adjust the spine manually, low force, tools, machines. I have a little activator. It's a spring loaded device that I will use on people. Whereas, like when you're doing a manual adjustment, typically I would, take a contact, bend the head, turn it, just give it a little quick thrust in there. This little tool just comes up to the bone that's out of place, and I just click that bone into place. And then
Oh,
that way you don't
cool.
have to worry about any of the blood supply, arteries, nothing like that. And then, two, I'm really big on doing muscle work because all of your muscles are
Yeah.
connected to those bones. Most of the time, or a lot of the time, those tight muscles are pulling those bones out anyway. So we have
Yeah.
to nurture that, get them breathing, get them taking probably a little bit of magnesium, drinking some water, doing some stretching. So there's other avenues other than just the manual adjusting. And there's people who have said to me, please don't manually adjust my neck. And I always remember that. And I respect what they say. But most of the time, people do like their necks manually adjusted, but I totally
Yeah.
get it if they don't. There's other avenues.
I love that you said that muscle work too, because I think like, it plays such a huge role in it because we do these repetitive motions for whatever we do all the time. Our muscles over tighten in certain ways. And I know like shoulders, especially like, how many muscles and ligaments are involved in your shoulders.
Mhm.
This muscle work is so important. It's just going to keep pulling you back out if you don't do the right muscle work.
100%. Yep.
So if someone is listening to this and they live close enough to come see you, how would someone initiate that or get involved, or where would they go? In case they're
Well,
just
they
listening,
can,
because I'm going to put everything in the show notes, but
gotcha. Well, they can call the office and set up a consultation. 618-398-5476. They can get on the website, which is drbridgetlybarger.com, and the doctor is just DR, and it's all lowercase. There's a contact form on there that they can email us and set up a consultation. They can also text the office cell, which is 618-401-3312. And then I'm on Facebook too. So I have a personal page and a Stages Wellness Holistic page under Dr. Bridget Lybarger. Feel free to DM me on Facebook or Instagram to set up a consultation as well.
I love that. I love that. Okay, and so I ask all my guests this, but what is your go-to self-care when things are like spinning out of control for you?
I would say yoga, taking a nice salt bath. It's a
Yeah,
whole routine. It would take me like 3 hours.
I love it.
Sitting in the sauna, doing red light, little bit of yoga, a bath, and taking a nap.
I love
Eating
it.
a good lunch before I take my nap.
I love that. That's great. It's a routine. That's great. Like a crisis routine. That's great. Love that.
Yeah.
Okay. Is there anything you want to leave us with before we wrap up? Anything you want to say or put out there?
Well, I just want to say, just to give everybody hope. I mean, everybody's got the power to take care of themselves. Community is important too.
Yes.
Reach out to family, friends. I would say boundaries. Boundaries are very important too. I mean, my main thing would be, just start a minimal self-care routine. It's all about consistency, patience. And then I just want to thank you, Jen, for having me on this podcast. I really greatly appreciate it.
Oh, yes, anytime. I absolutely love that. I feel like there's so much more to learn about each one of these things. Like we just brushed the surface. So maybe we'll have to have you come back sometime so we can dig deeper into some of these. So thank you so much for coming.
Absolutely. You're welcome. You have a great day.
You too.
Thank you.